Hi, my name is Abigail Barajas, and I am here speaking to you from the Santa Rosa Community Health Clinic. And today we are going to be talking about the implant. Other known names is the Implanon. So if you can see that right here, right? So the Implanon is a birth control method that you use, and this Implanon is a method that you use, and it goes underneath the arm. As you can see right here in the little arrow, it shows that it goes right under the arm. It's just a little tiny rod. If you can see this right here, you see the rod right there. So it's a very flexible rod, and it is put underneath the skin. And if you can see, this is a simulation of a skin. So if I was to pull this a little bit tight, you could see that method right there. So this method, what it is just a little rod that's inserted underneath the arm. Like I said, is under the skin. And what it does is your own body heat actually extracts the hormones 24 hours a day. And so I also want to talk about how do these methods, these hormonal methods, work to prevent pregnancy. So what it does, it actually stops ovulation, meaning it doesn't let the egg come out. It thickens the cervical mucus too, so that the sperm cannot get in through the cervix. And it also thins the endometrial lining so that there's not enough lining in the uterus. So in order for a pregnancy to begin, you need to have enough lining in the uterus so the egg can implant. So you can see that little diagram right there, right? It stopped the uterus right there, the fallopian tubes, and then we have the ovaries, the vaginal canal, and then the cervix. So it works in those three ways. So once you put it in there, it's pretty effective because it does what it's supposed to do. However, we always recommend that if you use this method, it's 99% effective. We give 1% for human error, but how can you make it a lot more safer is to use a condom. If you use a condom, it also protects you from sexually transmitted infections, and it prevents HIV because the method itself does not prevent HIV or STIs. And and people always ask, so what are the side effects to this method? Well, it does have some side effects, and one of them may include spotting in between your periods. Like I said, it makes it so the lining doesn't grow in. So our bodies, for a little while, will create the lining, and then the dominant hormone will say, no, 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 no. So sometimes what happens with some women, and not every woman experiences the same thing, is that she will have some spotting in between her periods, maybe for a prolonged period of time. And some women have no spotting at all ever. They just don't have a period. So a lot of it depends on how many days you bled before you even had the method. But one of the most common side effects is that you will not have periods. So let's go ahead and look at the next frame. So this next frame, people always ask, well, how would I pay for that? Well, we have actually a confidential insurance. It's a confidential insurance that the state of California provides, of course, thanks to all of us taxpayers. So what does it cover? It covers any family planning service, like pregnancy testing and birth control, male and female sterilization, and of course, there's some limited service in that part. STI testing and treatment, education and counseling. And the education and counseling is about you coming in and asking about your method and getting all the information so that when you make a decision, you have some information. Access to other family planning related services may be available when these are provided as part of a follow-up. So let's say that you had something that you needed to be followed up and it's got to do with family planning. This card will continue to pay your doctor visits. So all of these services are available to males and females within the ages of 12 to 65 for men and 12 to 55 for women. So women can access it even if they have insurance. They say that you have insurance, but your insurance doesn't cover reproductive health. You can apply for this. This is free and confidential, meaning that nothing will ever be sent home, letting you know of the services that you accessed or anything like that. And so these services are available when you apply for it at the clinic when you come in. So I want to talk a little bit about our adolescent services. We have services for our teenagers, and we have a clinic, actually we call it a campus, at Elsie Allen High School, okay? So some of the services that it covers is reproductive health, primary care, so meaning if you don't have a medical home for your teenager or your adolescent, here's the home for them. It also provides mental services and dental care. Once a month, they will do some dental cleaning. We also have a taxi service available to youth, but right now during the COVID, we're not using that service right now, but we will give you some further updates on that. So other resources near you. I mean, I know that not everybody lives in Santa Rosa, so you may want to know where other place you can go. So Planned Parenthood is one place, and they also accept that health access card. West County, Forestville, Petaluma Health Center, and Alliance. So those are some of the other clinics that you can go to. So we're gonna leave it here. We're gonna leave this question up. If you have any questions that you're comfortable asking, you can go ahead and leave some questions on the comments. Or if you want it more private, there's our email, abigailb@srhealth.org, and Jasmine h@srhealth.org. So that's all for us today. Hopefully this is good information for you. And of course, and in the future, if there's any topic that you want us to talk about related to family planning or not, maybe some life skill stuff, you can go ahead and leave us a little message, or you can go ahead and drop us an email and let us know. But for now, we're gonna go ahead and say goodbye and have a good day. Stay safe out there. Abigail Barajas and Jasmine Omar. Thank you.